So I'm Susan G, and on behalf of the New Zealand Dementia Foundation and the Dementia Leadership and Advisory Group, I'd like to warmly welcome you here today. And we have got an amazing lineup for today. So I'll get us started with our first speaker, who is Annabel Grant. And Annabel is a speech and language therapist who teaches at Massey University. She's the expert advisor for Dementia Mati Wareware for the New Zealand Speech Language Therapists Association. And because Annabel is clearly a superwoman, she is also doing her PhD in the area of friendships within people who have dementia mati wari. So very safe hands to get us started today. And Annabel will be talking with us about supporting conversation, connection, and memories.
Morena, everybody. I'll just share my screen. How's that look?
Spot on.
Excellent. Okay, well, I'm aware there's a broad range of people in the audience, so I'm hoping that there's either something for you here, something that sparks a thought, and I would just encourage you, if there's something that you want to know more about, you'd like the slides, a reference, or to ask questions later, please get in touch, and I have included my email at the end. All right, so a little bit about me. So, ko tirana, ko ingarani o ku tipuna, no te tihi o maru aho. So I was born in Timaru. Ke te noho o Tamaki Makoto, ko Annabel Grant, tōku ingoa. So yeah, I've got family links to Te Waiponamu. Had family there and did my training down there. And Susan mentioned I am doing my PhD in this field of dementia and social connections. So I have a strong feeling that we can do things to support people to keep social connections going, because as I'm learning more and more, it's really good for our brain health and our wellness overall when we can stay socially connected. And I think that would be one of my messages, that although I'll start with a little bit broader, that really I'll be giving some practical strategies about how to keep conversations going, because that's how we socialize, through conversation. And I think having a good conversation is an act of caring. So hopefully there's something in here that might help you to support conversation going forward. So I think one of the overarching concepts that I quite like is building reserve. And obviously my favorite topic is in there, social reserve. So I guess just to put it in a context, when we think about brain reserve, that might be how much structure in the brain you have, your neurons and connections that you have to back up all the thinking and conversing and socializing that we want to be able to do. The cognitive reserve is, I guess, how does your brain use those structures, those connections and different parts of the brain to work around, perhaps if with dementia happening in the brain, maybe the cognitive reserve means you've got something as a backup to work around and find a new way of hopefully keeping communication going. I think emotional reserve is important, and you probably hear things about filling your bucket. And I guess in the act of either living with dementia or talking with somebody with dementia, at times you have to have some emotional reserve, perhaps more than you needed in the past. So I guess if you have some emotional reserve, you can handle the ups and downs of day-to-day life and day-to-day conversations. I guess we're aiming that somebody living with dementia can, keep some confidence, their sense of identity. Perhaps you're the conversation partner. Can you control your feelings and just think reasonably about the situation? in amongst times where perhaps there's memory loss or someone is experiencing confusion. So I think for people living with dementia, that emotional reserve helps them to, still keep their sense of humour, their core identity, despite some of the changes that might be going on in the brain. So I think emotional reserve is really shaped by how much social reserve the person can access. And I hope that by the end of the talk, you might have a few more ideas about how that can be built up through good communication skills. That's the aim. So I think you all have some ideas about what good communication is in your day-to-day lives. We know the basics, so they all still apply. So the things like eye contact, not talking too quickly, not interrupting somebody, being a good listener, picking up on somebody's non-verbal, their body language. So we know it's not just words. So, don't throw those things away. But I guess we're thinking about the wider context. And again, that idea, how do we build up someone's social reserve? How can we ensure that they're able to communicate and converse? I think that some of the broader attitudes to dementia in society can influence. So I guess I'd be hoping that messages become more balanced away from, I guess, negative depictions of what it might be looking like, acknowledging that there's ups and downs, but also showing that there are ways that we can help people maintain social connections and have good conversations, despite, new challenges. It's important because, keeping, I guess, socially interactive, as we know, is good for the brain. So I guess we're thinking, how can somebody keep some autonomy about how they connect socially, making choices about who and where and how they want to interact. And again, that idea that having a good conversation really is an act of caring. So I guess getting down to a bit of thinking about how do we communicate effectively and what are some of the core skills. And obviously it's a interaction between a speaker and a listener, and whether you are the listener to somebody with dementia or vice versa, you're both engaging in some observation and mind reading to get the job done. It's not just about the words, it's you thinking what's going on in this communication situation. So obviously we're thinking, how can I put my message together in a way that's going to work well for this listener? We might observe, seeing, do they look like they're on board with what we're saying? Do they, are they looking like we might need to rephrase something? So we kind of also mind read. We're thinking about what do they know or understand about the topic that I'm talking about, and vice versa. How's my message going to come across? So we need to sort of, think a little deeper, I guess, especially in the situation of keeping up conversations when one of the people has dementia. And I guess we'll go through some strategies, but just practicing thinking about what the other person might be wanting to achieve, what understanding are they coming from when they enter into the conversation, what might be hiding under the surface of the words that are coming out. How can you reassure somebody that you are listening in a deep way? So I think quite a useful way to think about approaching a conversation is scaffolding. So what do I mean by scaffolding? I would say that you might be thinking about changing how you say things to make them easier for somebody to respond to. And often the idea of just asking somebody a yes/no question, or what we call a forced choice, just saying, do you want A or B? Those are the things that tend to come up. But I think we can do better because, conversation is much richer than just batting questions back and forth. So rather than asking somebody a fact question, which we know when there's challenges to memory, that can be too much. We want you to provide more context. So I'll give you an example. If you asked somebody a question that's asking them to pull a fact out, you might say, perhaps in talking about their husband, when did you meet him? So you've asked a fact question that is hard, and you've said him. So that's, not giving much of a clue. So I would say there's no scaffold. If you provide a little bit of context, you might say, how did you feel when you first met Dad? So there's a bit of a scaffold. You've been more specific and used the word Dad. But rather, if you were going to fully scaffold and provide as much support as you could in that chat, you might say, I know you met Dad at a dance when you were both living in Raglan. How did that feel when you first met him? And that's a much more significant scaffold. You haven't started with a testing question. You've shared what you know, and then the person can recognize the specific words. You've given them lots of cues and pointers, and they can come in and join in the conversation because you've given that scaffold. So the starter, didn't you, can be quite a useful one. Didn't you used to be a nurse, so didn't you tell me once that this happened? So that's the start of thinking about how you might scaffold the conversation. The other idea there is using visuals, and I'll come back to that idea. Lots of examples. So just some changes to improve conversation, getting down to some of the specifics. It might be about the timing. I mentioned rate early on, rate of speech. Some of the advice says speak slowly. I would say be careful not to speak too quick, but just keep it natural, because I don't think speaking really slowly, I think it can come across as patronizing, and I think just not racing along could be useful. But it's the leaving the pause, which actually in normal conversation is like a split second. It's just so tiny that we bat conversation back and forth. But if you just leave a little bit of a gap, give someone time to process and respond. And when somebody's trying to communicate, even if they have quite a long pause, doesn't necessarily mean they've finished their turn. So I guess it's just being a little bit more tuned into what is the ideal pause. You don't want to leave it too long, then everybody might forget what the topic is. But certainly just be aware of how long the pause you leave is. I talked before about the fact questions. So rather than asking them to dredge up a fact from memory, I think you said you were a typist, or didn't you used to, be a horse rider? So any way to avoid asking test questions, rather adding in those scaffolds, works really well. Tag questions as well. So that's where you say, oh, your daughter came to see you this morning, didn't she? Rather than saying, who came to see you this morning? Those sorts of tips and tricks work well. If you are the person living with dementia, how might you approach things when you can't find that word? We know that vocabulary starts to shrink over time. So what might you do? If you can't think of the word, you might be somebody who can laugh it off and move on and say, it'll come to me later. Or maybe you enlist the help of the other communicators in the room, and you say, oh, sometimes I can't find a name. Can you suggest, help me out or give me more time? So taking charge of the communication situation. If it's something you really want to get it right, maybe you write a script out, or jump online and ask one of the AI tools to give them a few words and say, please write me a script to explain a concept or prepare for a piece of communication. So I think there's a role for bringing in technology to help you plan what you want to say and perhaps rehearse things. And I guess just appreciating that people want to help you understand, you can draw a line in the sand and say, this is what's going to help me, so that they get it right. You don't want people to over accommodate and talk down into being patronizing. Just saying what are the things that will help you stay in that conversation. Yeah, and then if you're the conversation partner, again, do they want you to help by suggesting a word? Do you want to say, did you mean such and such? Visuals, we'll come back to that one, using pictures or rephrasing your message if, again, you can see that it didn't land correctly. Maybe thinking about using words that are maybe simpler and more commonly used might be good. So the example there, saying the stamp collector was 100 years old rather than the philatelist was a centenarian. Just be aware, and I know that day-to-day variability is common. So, if somebody's very tired, that's going to hold things up. Could you come back to it later, or note something down and revisit it? If you're keen to know more and to perhaps see some video examples of these communication tips and tricks, there are programs available. This one's called Message. It's from the University of Queensland, and if you go onto YouTube and look for UQ Dementia Care, you'll be able to access videos showing you an example of each of these kind of communication scaffolds or supports. Some of these that we've mentioned already, about using shorter or simple or familiar words, picking up on body language, and assisting with visual aids. We'll have that example. So just to pause here, one of my favorite, I guess, quotes that I heard about approaching conversation with people with dementia was to think of it like a dance. And this was from Heidi Hamilton, who's a professor of linguistics in the States. And she said, talking is like dancing. So dancers who are sensitive to what their partners can and cannot do make important choices that can make their partners look elegant and agile, or ones that can make their partners look silly and uncoordinated. So I think those scaffolds that have been mentioned are ways that you can make your conversation partner look competent. The words you choose, the way you structure your sentences, how you support, are all ways to support the situation. You may have come across the idea of carousel questions or repetitive conversations is something that comes up. So how might you deal with it when a question is being asked repeatedly? Think of it as a carousel. I guess the person's getting on the conversational carousel, gets the conversation started, and it comes around again. And obviously memory, the reason is because of that short-term memory problem. So just have a think, and just think, what might the person need? Is it less about what they're asking repetitively, and is it something that they need that, do they need to connect? Is there something that is a want that is deeper than just the surface meaning of this question that they're coming to? And I guess this refers back to the emotional reserve, how you building up your emotional reserve so that you can, with patience, provide reassurance, keep your answer simple, acknowledge if there is a feeling behind the question that's coming up again and again, using a memory aid, maybe writing down what the questions tend to be and what answers worked best to allow someone to move on. And I guess sometimes we might all just need to distract ourselves by going for a walk, having a snack, saying we'll come back to it later, or perhaps using a visual, which is the next example. So I've mentioned visuals a number of times, and it's one of the strategies in that message list, and is a really good way to scaffold conversations. You literally can be on the same page as the person that you're talking with, something that you can both see. Helps to center the conversation, helps you talk about the here and now, and talking about the here and now usually works better. So it can be the newspaper, old photos, going over a map of the trip you've planned for, going away to a batch at Christmas, whatever it is. Having something that you're both looking at can help. Then you can give your opinion. You can say, oh, I didn't realize that you had to drive through Kaitaia to get there. And then the person's got that scaffold, they've got the same page, and then they can share their thoughts and ideas. Again, coming back to the idea of using AI, if you're running a group or needing some conversation topics, maybe you can go to a news website like the Herald Online, take an article, put it into an artificial intelligence. I use Claude, it's quite a nice one. People probably starting to hear things about Chat GPT. You can put the words in, say, can you please give me a easy to read, short paragraph that summarizes this this news, about the new presidential candidate in the US or something. An easy read version that could become your visual for the group or whatever activity you're trying to do. So okay, so a few kind of checklist things of things to think about if you're the speaker or the listener. So if you're the unimpaired person in the conversation, just thinking about some things. What did you do? Did you and ah a lot? Were you making eye contact? Yeah, what were you doing to scaffold the conversation to make it easier for the person to follow? So certainly one of the tips would be staying on one topic, as long as you can. And I guess, you might have a friend who jumps from idea to idea, topic to topic without any pause, and it can be quite disorienting and hard to keep up. So again, how can you maybe be a bit clearer about when one topic's finished and a new one starting, so that the listener isn't in that situation of trying to keep up. I guess just remember that how you say something might convey a lot. So your tone of voice, your body language, what your face is saying can carry more weight than the words at times. And the context mentioned before. So is there some, it's the person got some idea of where this topic's sitting. If you're going to change the topic, give them a warning or flag it. Almost, if you're writing a paragraph, sometimes you give it a heading so that the reader knows what the topic is. Can you do that somehow in a conversation in a natural way, just to accommodate? I guess consider expectations. Think back to those core ideas from earlier. To communicate effectively, you have to put your message together in the most appropriate way for your listener. So do that observation. Think about what the listener's able to do, and then mind read, work out how do you think your message is going to come across, so that it's sort of reasonable that they'll be able to take on board and respond. Okay. So yeah, just again, coming back to some things that you can help somebody do. Again, don't forget the basics. Has the hearing aid got a battery? Do they need glasses? And allowing them time. So we talked about pausing, maybe slowing down a touch, but not too much. And I guess the main thing is just being prepared to patch up a conversation, to fix it if it needs repairing, so that everybody leaves the conversation with their dignity intact. If you're the listener, I guess, again, just thinking, what did you assume they were going to say and mean, and was that the right assumption? I guess, yeah, I mentioned, thinking about what I want or a need, excuse me, underlying what they're saying. If they keep asking what the time is there some anxiety underlying that? Maybe they need to be reassured more than they need to know exactly what the time is. So just thinking about what assumptions you're bringing to what you're hearing and how you're evaluating that. Okay, so I guess one strategy to help keep things going might be to reflect back what they just said. Imagine somebody says something and it doesn't make sense to you. Is maybe try reflecting it back. So a lot of these tips and tricks have come from, again, a linguist called Alison Ray, who again has some lovely YouTube videos about conversation that I'm happy to share the link. She said, I think her mother had Alzheimer's. She said, Mum once said to me that she had 2 sons and no daughters. And I reflected back her statement like I had no idea about her sons, which in this case I didn't. She said, oh, so you only have 2 sons and no daughters. And then her mother went on to talk about her 2 brothers, which is what she really intended to say. So just sitting there with a bit of patience, reflecting it back meant that the conversation was repaired. Nobody lost face or was embarrassed. There was just some time given to, I guess, bouncing the words back and forth until the real thought behind that emerged. So, yeah, just a bit of patience to fix things. So that being a good dance partner might mean just giving it a little bit more time. Memories. So memories was one of the things I said I'd covered. So I'd cover, and I think it links in with visuals that sometimes a simple strategy of gathering things together in a book or a folder to be able to converse and communicate about memories is a really good idea. So having photos, maps, written text about things that you like talking about. Memories from the past can be a great idea. So that's something that you can tailor with an individual. It works well because once the information is down there, that the person, can pick it up as a tool for conversation and just recognize rather than having to pull a whole lot of facts out of the memory. So I worked with a lady called Evie when I was doing my master's. It's obviously a pseudonym, and she had a lady visiting called Janet. And when Evie was asked to tell the story of her life, Janet quizzed her and said, "What year were you training to be a doctor, or what year did you get married?" And Evie looked really, didn't look very confident in that conversation. She really struggled. She looked forgetful. She couldn't organize her answer. Then we put together a memory book for her with, photos of her wedding. We listened to her stories and wrote them down in paragraphs under each photo, holidays, pets, you name it. It was all there. And then revisited that conversation, and she just looked so much, she was in charge. She held the book. She told the stories. She embellished because she didn't have to pull out facts. She was just able to recognize and go from there. So that is, a memory book or having things down visually can just completely changed the direction of a conversation. So it's tangible. There's no demands on your working memory. It's personally relevant about things that that are part of your identity. So certainly, a great thing to do. People use their own vocabulary. It can be a book, it could be a wallet for gentlemen or for ladies that are used to carrying a wallet around in their pocket. Maybe it's less about life memories and more about names and words that they want to remember. So those are a really good tool. The size of the text is important. Obviously, you're dealing with, what visual skills people bring. Perhaps in the earlier stages, there might be some more complex information that could be simplified over time as needed. And maybe, again, using AI might be useful. Just to jump to something else, if you rather than conversing about memories, if you just wanted to have a more imaginative conversation, then you could try something like asking beautiful questions. So there's a movement in the US called time slips that's all about, using your imagination to tell stories. And one of their, side projects was beautiful questions. So asking people, what kind of food makes you happy, or what's something you're proud of in your life, and jumping into a more imaginative conversation can be a lovely way to communicate. And you'll be able to find some information about beautiful questions on their website. I've got 30 seconds left, so I'm on the last slide. I'm doing well. The final way to approach communication that I quite like is the idea of quilting conversations. So just thinking about perhaps later on when people are giving you snippets of a story but not the whole thing, that maybe you make a note and do that thing where you reflect back. Oh, you were telling me about the dog on the farm, and then the next time you see them, you bring it up again, and maybe they embellish and they say, oh, he was a good boy. And then the next time you see them, you say, oh, you were telling me about the dog on the farm, and he was a really good boy, he'd wait for you. And just over time, you might start to quilt together all these snippets to get to a story that the person enjoys talking about and conversing about. And that, I think, is the end of my time. So I will stop talking. If you want references, want to know more about anything that I mentioned, that's my email address. So I'm going to stop sharing. And I think might be some time for questions.
There is, Annabel. You were so organized. I just loved that final kind of image of conversation as a quilt. I thought that was beautiful, Annabel. That working together and piecing together something that is useful and beautiful is just such a lovely way to think about conversations. And and I can see that Carolyn Bartle was also saying that she loved the dance.
Yeah.
The analogy of a dance as well. So we do have some time for questions. You can either type them in, or if you raise your hands, we can turn to you.
I'm just checking the chat.
And just to say that Annabel has mentioned a whole lot of useful resources, and we will gather those together and send out some of those links that Annabel talked about, because there was a lot there, wasn't there?
Yeah, I'll do a slide deck that's, got the basics and got the links for you.
Yeah. And we've got compliments coming through and loving the practical ideas. So, Annabel, I was just wondering, I know that you've sort of been one of maybe the early adopters in New Zealand, I think, with the time slips. And I was just wondering if you could just talk us through a little bit about whether that's something that people use formally or informally, and how you use those kind of resources.
Yeah, so the time slips came from a lady that was kind of volunteering in aged care and just was struggling to find something that got people with dementia talking. And and she had a theatre background. And it wasn't until she turned up one day and gave everybody an image, you know, perhaps imagine sitting in a group and they all had a photo of, I don't know, I think one of the images is a polar bear, you know, flat out on the ice, with a newspaper in front of him. So they're not images of, I don't know, Marilyn Monroe or anything where there's a right or wrong answer. It's coming from that theatre idea, theatre sports sort of, yes, you know, nothing's wrong. So just tell me, it's a storytelling intervention. What would you like to call him? What do you think's happening here? And people can give their snippets that get, like, much like the quilt, get written up and tied together into a story that's retold, so that the people in that group are taking on the role of a storyteller, because perhaps some of their roles have been, you know, taken away. But to have the role of the storyteller is a familiar one, so they can become the author of a story that they collectively create. And I think that can be done formally in aged care. It's a lovely thing to do as an intergenerational activity. If you know, got the primary school across the road, which is something that we've done in the past, and bring them in and run a storytelling group. It's beautiful to see the, you know, older adults looking after the kids, making sure they get a turn, sharing their stories. And, you know, that's a lovely, I guess, conversation tool, where there's a product at the end of like a piece of art, I guess, that they have collaborated on. Yeah, but you can do it informally. You can go on the website and have a look at some photos if you know, then you can have one of those more imaginative conversations.
Thank you so much, Annabel. And just to let people know that Annabel's and the other presentations, we will put those videos up on the New Zealand Dementia Foundation website. We've got some people saying, I'd love to share what Annabel said, so many practical tips. So we definitely will be doing that, so that you can share it with people you think would love to hear from it. Now, just one last question from Carolyn about, do you have any tips for communication technologies for people living with dementia, Māori Wareware, who also have sensory loss?
Yeah,
Big topic.
thinking about that. Can't think of anything technology wise. And there's, so hearing and vision.
We may be able to come back to that question at the end and ask all of you together, with Katrina and Megan and you, to have a wee brainstorm about that.
Yeah, let me ponder.
Yeah, excellent. Well, thank you so much, Annabel. And our next speakers are absolute treasures. So Cheryl Nettleton and Nick Eyes have made, yes, hi, have made a real commitment to share their experience and insight as carers, to help make a positive impact and to really make that emotional connection with the experience. And you are about to find out just how special they are. So Cheryl and Nick are going to be talking with us about communication matters, the carer's perspective.
Thank you so much, Susan, for that huge introduction. Now we have to live up to it.
We'll try our best.
Nick and I have been walking a journey. I'm still walking it. Unfortunately, Nick will say his part. He's lost his lovely wife, Anne. My husband is in a D6 facility now, and I am struggling with engaging with him now, Annabel, because he's no longer talking, walking, anything. It's really difficult going in to visit him and try to have a meaningful visit. So I'll talk to you about that a bit later. Our journey's been a number of years. I've been about 20 and Nick 15 years, yeah. So we've gone through a lot, and yet not a lot has changed. And we will focus more on young onset because that's where we all started. And we feel that there's not really enough said and focused on young onset when it's a growing thing that's happening here. And well, it's worldwide. It's worldwide. But for us, we do lots of talks. We work with Walking in Others' Shoes, and we give the carers perspective with that, with community caregivers, with caregivers in rest homes, and with our nursing students and with RNs. So we give our perspective, and we always have a box of tissues, okay? And we have them crying at every time. And I'm sorry, it sounds really bad, but our main thing is we want everybody we're talking to feel, really feel what this disease is all about, what it's like for our loved one, but also what it's like for us and our families, which is huge. And if facilities don't embrace the family as part of the community in the dementia facility, that's hard. That's really, really hard, because when we make that, well, when that decision is made for us, or when we are agreeable to that decision to move them into care, we go visiting them all the facilities, we check them out, and, you know, sometimes beds are available, sometimes they're not. But when we make a decision and we take them through those doors, we have to have a huge blind leap of faith and trust that that facility is going to look after our significant other. And could you imagine how hard that is? We've got to let go of the reins. It's really, really, really difficult to do. We're entrusting our loved one with strangers. But if that facility embraces the family of that new resident, the facility will have a better journey, the person with dementia will have a better journey, and so will we as families, because it becomes a community within that environment if that's allowed. So I've talked enough now, we'll come back, but we'll let Nick do some talking as well, because he loves to talk.
Yeah, thank you, Cheryl. If I may just start by saying, Annabel, you know, listening to your talk was like liquid gold to us. It was refreshing. You obviously come from a source of good knowledge. You're obviously very passionate about the subject and about communication, about how we communicate with dementia patients. So to us, that is just wonderful to hear. My wife passed away sadly 3 years ago. Anne and I are married for 45 years, just the most wonderful relationship. As opposed to what has happened to Cheryl, we are a couple with no children involved. So purely our dynamics was around friends and family, and we know how that affected our lives and my life in particular as the carer. And from what you talk about communication, is something that we experienced throughout the journey of dementia, and something which clearly you understand and your audience, you know, hopefully understands. In terms of what you've put forward is the parameters of how do we enter the world of the patient with dementia, because clearly it is a world which is different to normality. And when we talk to nurses and carers, we particularly talk about entering the world of the dementia patient and the communication with the dementia patient. That communication is so important to us. And different carers have different needs. For instance, Cheryl's got a family with 2 young children who got affected by dementia, and which was part of the journey, which also needs to be inclusive of any conversation that's been held with the carer of a dementia patient. Cheryl, I'll just let you carry on. Thank you.
Okay. Really, to us, it's all about how we make them feel. It's how, as Annabel was saying too, they're our most vulnerable, but to communicate with them, we feel we all have to be just as vulnerable as well. And if that means you look like an absolute idiot because you're dancing around the room like a big grizzly bear, or you're singing and you can't sing a note, who cares? Or you are singing nursery rhymes to them, or you're making them laugh. I don't care what it is. But if the staff can engage with a resident like that, they build rapport, they gain trust, they learn more about the resident. And if the families see the staff being vulnerable like that as well, they will mimic that behaviour with the resident. It will become more like second nature, and it's much easier for them to think, well, this is normal. I mean, this gentleman can do it so well that he can walk out the door of a D6 facility, and a lovely family member is going, no, I don't think you're allowed out of here. I think you need to go back inside. This is where you live. They thought he was one of the residents.
I spent a lot of time. I spent a lot of time banking checks for people, helping plumbers repair pipes. You know, I had a woman in a facility the other day walk up to me. She said she was 87 years of age. She walked up and she said, "Now something terrible's happened." I said, "What happened, Mavis?" She said, "Mum's just lost her job. She's resigned." I said, "Oh dear." I said, "Tell me a bit more about it." She said, "Oh, Dad's not very happy." So what does Dad have to say? She said, "Oh, Dad's furious. That means that I'm going to have to go out and work now." So she was living in that real world. Her parents had passed away many, many, many years ago, but she was very realistic at that point that Mum had resigned. I said, "Where did Mum work?" She said, "H.G. Wells." And I didn't know who H.G. Wells were in Christchurch. And I asked one of the people working in the facility, and she said, "Oh, they used to be a haberdashery company in Christchurch years ago." So she retained that memory. But facilitating what she was saying as opposed to arguing against what she was saying became a whole conversation. And I must have spent 10, 15 minutes with her. So it is a bit of an imaginary world. And in terms of communication, that is so important that we also teach people like ourselves, carers who haven't walked that path, as to how to handle that situation. And that's where people in our audience, as professionals, have a care of duty to see that communication is there between the spouse, the loved ones, and those who are in care.
Mm-hmm. Even before they get in, they go into care, there's lots of sort of gaps as well. And there was with my children, because they were just young teenagers, when we started getting a diagnosis, which back then took years. It absolutely took years. And when they finally diagnosed Brian, he was already severe. So we skipped a whole lot of the resources that we possibly could have had made available to us, which was hard. And further down the track, it's like, okay, young children seem to get missed. And I started a support group 10 years ago, 18 years ago, for people like myself, because I'm not knocking Dementia Canterbury. I'm not. There is definitely a need there. But I was going to workshops with 80 and 90-year-olds, and I was only in my 40s. I had nothing, and I still had to earn a living, and I had nothing in common with them. So through the memory clinic and things, I eventually, after 2 years, managed to set up a group, and it's still running. It's about 50 strong, and it's really, really good. But what that allowed me to do was start doing a support group in the rest home that my husband's in, for families, not for the residents themselves, for families. And then I snowboarded off that and did them in other facilities. But then with COVID, I lost my job. So it was like, okay, I had to find another job. And guess what? I'm in the retirement industry. I'm still working with dementia. So it's still a passion for me. But it's like, how can you put it? It's going back to the kids side of it. They're a huge part of it. And especially when they're young, it's a very impressionable time. At the sort of when I put the group together, most of them had young kids, and most of them were on Prozac. Most of them were isolating from their friends because they didn't want their friends to come and see mum or dad behaving the way they did. It was embarrassing. Teenage hormones, wonderful. And further down the track, I thought, oh yeah, okay, my kids have done okay. They've done all right. But it catches up. So I did have a daughter that went through depression for about 12 months. That's fine. And then I had a son that went on suicide watch because he wasn't talking about what was going on. So when we do these talks, and particularly with the community caregivers, I really stress, please keep an eye on the kids. It's not just the person with dementia. It is the wife or the husband, and it's the immediate family, most definitely. They've got to be taken care of and watched as well. My goal, I would love to see every dementia facility in New Zealand have a support group for family members. I started one here where I work. I haven't got it within the memory clinic yet, but I've got it because out in the community, there's still a lot of people with dementia, and there's still a lot of people who deny that it's happening. And there's a lot of families that deny that mum and dad are suffering from short-term memory loss, whatever. It's hard, and that's my role. I'm dealing and working with people like that. But I honestly believe support groups, because it's not structured, it meets the need of what it should at that particular point in time of meeting, and you gain such a lot of insight. I never knew anything about WINS. I've never dealt with WINS before, and I tell you what, when you have to start dealing with WINS, dear God. But the rest of the group had different scenarios that played out when they dealt with WINS, and it was like, you're entitled to that? Really? Oh my God, but Brian's only getting $3.63 a week. No, you should be getting at least $30 odd. And it's like, you've got to ask the questions in a certain way, and then you might get what you're entitled to. But support groups are a wealth of knowledge as well. They're a wealth of experience and challenges and wins, and they're there to cry and laugh and vent and do whatever you need to do in a supported environment of like-minded people. So that would be my dream. If I could just wave the magic wand, I'd love to, because that's the thing that happens. We come from the outside world. We've been looking after our loved one for as long as we can, and we get that support from different resources out in the community. And guess what? When they go into care, it's gone. It's gone. So that's why I think the homes need to pick up that big gap, because families are floundering. Families don't understand what's really happening. Very few educate themselves like we have. Very few do. Like I know in my last place where I worked with Brian, I was receptionist there, and Brian was there. And I know I've walked this walk for a long time, but they would go into visit, and they'd come back down the ramp after their visit, and you could tell they were really, really, really upset. So a facility needs to keep an eye on that and take them aside. Talk to them, find out why they're upset. You know, it just could be that they don't understand the decline of this disease, and some days are worse than others. And again, we just need to embrace them, and we just need to make sure they know it's fine. That's normal behaviour. So next time, go in and do ABC. Some of Annabel's ideas were absolutely brilliant. Notice I took lots of photos. Thanks, Annabel.
I think my colleague Cheryl actually underestimates the power she has put into support groups and the great benefit that support groups have. People like myself, I joined Cheryl's support group early on, probably 2 years into Anne being into care. That's when I met Cheryl and her husband Brian. And the benefits are not just within the support group, but extend beyond that, because the grieving process, as you know, with dementia goes on longer after your partner has passed. You know, I'm 3 years down the track. There's still a lot of emotion involved. There's still support needed. You still need somebody to bounce things off. And within the support group, a lot of us that have lost our spouses, but yet we still belong to the support group, helping the next set of people coming through. And the same thing within the rest home situation. If we can have support groups set up within the rest home, run by the carers themselves, the spouses themselves, with the rest home adding the knowledge in from the carers and the nurses, those professionals within that organisation, it's going to make the years coming so much easier as we exponentially we get more and more people being admitted in the area of dementia. And particularly in the area of young dementia, we're seeing more and more cases of young people coming through. I know when Anne first went into a rest home, it was a rude shock. She got put into a rest home with a bunch of old people. As far as she was concerned, she was, mid-50s, in an old age home where they played old time music, that sang old songs. As soon as she entered the rest home into care, she deteriorated quite dramatically. So we've got to think about the younger age group as well when we do set up these support groups. But Cheryl does an amazing job, and is still doing the amazing job within the centre that she works, the care centre that she's with. So we are so enthusiastic about promoting the knowledge about dementia. People like Annabel, I just can't emphasise how important you are to the world of dementia.
Oh, thank you, Jennifer. Oh, that's good. Yep, that's our vision too. So how much longer do we have?
Whoops, about 5 minutes.
About 5 minutes?
Plenty of time.
I know, so hard.
But ultimately for us with communication, it is educating people. It definitely is our passion. We've done it for years and years. But really, probably the biggest take as well when we're talking to people is bring joy into their lives. Whether it just be a moment, whether it be 5 minutes, whether it can be half an hour, it doesn't matter. But to them it does. And if you can make them laugh, put a smile on their face, or just make them feel a bit more relaxed and happy, it's a win-win. Whether that be a family member doing that or it be staff member, I don't care. And again, it goes back to being vulnerable. I don't care if I sing off key. Wouldn't have it, and often I do. And it's never quiet. But, if I've got Brian in his room and I put on some of his favourite little songs, it's amazing how some of the other residents all start coming in and sitting on the bed, lining up. Who cares? Who cares? And that really, I used to really worry about what people thought of me. I think we go through an age where we do. And you know what now? I don't. This disease has taught me to be more patient than I ever thought I had. I thought motherhood would do that, but dementia certainly tests it. And tolerant. It has given me some skills that I didn't know I possessed. It's allowed me to meet different people, and you know what? It has helped me help others. I feel it's helped me make a difference. And I know Nick feels exactly the same.
I just
making a difference.
I just think, everyone has a story to tell, as does the dementia patient have a story to tell. And they might not recognise who we are or know who we are, but they certainly do feel our love. And that comes through communication, the way we communicate, the way we touch, the way we handle them, obviously all in the appropriate ways. But the power of touch is just, you just can't explain how important that is. Just a hand on the shoulder, a rub on the back, a holding of the hand, just acknowledging as the person talks. I never even knew Brian in his life before dementia. I'm his friend in his dementia world. He's got no clue who I am, where I come from, but he got to know my voice and know who I was. And I just love this guy as I've met him. So I don't see him any different. I just enter his world, spend a lot of time talking about his background, what he was, what he did. Brian was a very competent businessman who owned his own plumbing works. I've spent a lot of time fixing pipes with Brian and I know absolutely nothing about plumbing. And as Cheryl says, time and time again, people wouldn't let me out of the facility because they thought I belonged there. So it is a wonderful world in many ways, a very sad world, very sad from the perspective of us as carers. Having walked those miles with them leaves a lot of scars, but at the same time also brings a lot of joy.
I'm going to finish off with a wee quote. Too often we underestimate the power of a touch, a smile, a kind word, a listening ear, an honest compliment, or the smallest act of caring, all of which have the potential to turn someone's life around, even if it's just for that moment. Thanks, everyone.
Thanks for your time. Thank you.
Thank you.
Oh, what a beautiful way to finish. So much in there. Just thank you so much. That idea of being vulnerable, your idea of, I think you sometimes call it the joy zone, that the moments you can create together, and Nick bringing in that non-verbal, the importance of touch, the ways that we communicate love that are beyond words. So important. So thank you both so much. Now we do have some time for questions or comments, and that there have been some lovely comments through with people just resonating with what you're saying. Someone's saying about how they've just been on to wins this morning themselves. the
We're
issue
still not friends.
and that real acknowledgement of how tough it is with whānau who have people who start this journey young. And we're going to be sending out an email just to say there are some opportunities for some webinars that are coming up around young onset dementia. So there is a gathering storm. People are coming together, and I think there's going to be in August formalizing, trying to get together a group. So would anybody, I'm just going to just come down. Yeah, and that's Heidi saying, I truly believe the power of touch is one way of expressing how you love them. Very, very much so. And I think, Nick, one of the things that that you talked about, and that you're just so beautiful with, is that idea that it's not about fact checking and getting into an argument about what is real, because the emotion is real, and that you follow that emotion to still have a conversation that is about what matters to that person in that moment. And that is such a an underlying way of thinking about communication, isn't it? That we're joining someone, we're not correcting them and giving them, Annabel was talking about, we're not giving test questions. We're coming in with them to support that conversation. And I know that that's something that you have done with the residents that were around Annie in all sorts of different ways.
That they all understand that what they do understand is compassion and kindness. And compassion and kindness is one of the best ingredients you can offer a dementia patient. And that's the feeling side that they feel coming through as well.
Yeah. And that comes from that place, like you were saying, Cheryl, about being willing to be vulnerable. That was an amazing message. And I'd just like to echo, we've just got a comment coming through from Angela, who says, thank you so much both for sharing your hearts. God bless you both, which I think is just,
thank you.
And thank you so much. And Cheryl and Nick have said that if people do want to get in contact with them after the webinar, that they're happy for us to help you get in contact to talk more with them. Maybe you've been sparked with the idea of setting up a group of your own, and you'll never have more passionate supporters than these two. So thank you so much to you.
Thank you.
Jennifer Watson. Okay. Thank you.
Lovely. So our final session for today, we have Katrina McGarr and Megan Eustace. And Katrina is a speech language therapist and educator from the University of Canterbury. and she's been a passionate supporter of helping people living with dementia to engage in meaningful communication from way back. She is a board member with Dementia Canterbury. And Megan is also a speech language therapist. She has a particular interest in the communication support preferences of Māori people who need that kind of support. She's done research in that with people who are stroke survivors, and she's now embarking on a PhD looking at the support preferences of Māori people who are living with dementia mari. And so they are going to be talking with us about e ai o harirau hireria mai. You have the wings to fly here, supporting communication skills and identity. So thanks to Katrina and Megan, who are going to be taking us home.
Ngā mihi, Susan. And thank you for finding that title for us, because it really does fit. And listening to both Annabel, Cheryl and Nick, and it's great to see all your faces. Kia ora. You know, I feel like we're a really good bookend to come in now and share this kōrero with you, because I feel like it is a weaving of what Annabel shared and again what Cheryl and Nick have emphasised as people who are living next to, as the family members of people living with dementia. So I'm going to hit share on my screen. Let me know if this doesn't work for you. Has that popped up?
Yep.
Yep. Tauke. E ai o harirau hei rere mai. You have the wings to fly here. And like I said, just a little bit of bringing those two ideas together and really builds how we work with and how we envision supporting people with mate wariwari. So ko wai maua. So who are we? Who are we to come in and talk to you? Like Susan said, my name is Katrina. He urio no kaitahu, ko Awarua te hapu, no mawhera hau. So I whakapapa to Awarua, way down south and Bluff with kaitahu. And I grew up in Greymouth and I now live here in Christchurch. I used to work as a speech therapist in older person's mental health here at Canterbury. And then moved over to the University of Canterbury to work as a clinical educator, where my role here is around supporting students in their clinical placements, and one of those is still in collaboration with Dementia Canterbury, where we run a cognitive communication group. And I'm also a long-standing member now on the Dementia Canterbury board, championing is the clinical eye there. But ho atu ki rākau kia Megan, I'll pass over to you to introduce yourself.
Kia ora Katrina, tēnā tātou, ko Megan Eustace tōku ingoa, he uri ahau no Taranaki no Ngāti Raukawa hoki. Kia ora, I'm Megan. Thank you for the lovely introduction, Susan. So yeah, I'm a PhD candidate at the moment at the University of Canterbury, and I'm working on a project that's looking at better understanding Māori perspectives on communication and aligning communication supports with those perspectives and with those Māori needs. I got into this research partially thanks to Katrina. So it's quite cool to be speaking with her today. During my undergraduate study in speech and language therapy, I also spent quite a bit of time learning about and reconnecting with my own whakapapa Māori. And Katrina was a big part of getting that journey started. And I was very lucky to work with her on a project that looked at Māori aspirations for communication support following stroke. And I just absolutely loved doing that kind of research. I found hearing the stories of people who'd actually been through it themselves was so valuable. So special thanks to Nick and Cheryl for your beautiful stories as well. But yeah, I just loved it. And so I'm still here, still going strong, but I've moved into mate wareware now. And a lot of my early PhD research has been looking at reconnecting with ancestral Māori knowledge around communication. So I wanted to kind of share some of that knowledge that's come through today as a way to kind of get us thinking about and talking about how communication and connection might look to different cultures, and particularly to Māori.
Kia ora. So I thought just sharing a little bit about our philosophy, because I think for me it's continuously evolving, and it's shaped a lot as an educator, you know, working alongside students and feeling like I'm constantly trying to motivate them to also be engaged and excited about supporting people with Mati Wareware. You know, I remember when I first came into this role as an educator, and you know, students sort of they've come into speech language therapy thinking I'm going to help people, and then they're met with someone living with dementia and realizing that it's not something that they can rehab. It's not something that they can provide an intervention and see someone get better, which is what they envisioned their role would be as a speech and language therapist. You know, and so I had to think a little bit more creatively. How do I share why this is so valuable? How do I get them to really appreciate the input that we can have when we're working alongside someone with dementia and their whānau? And for me, it started to move toward meaningful connection rather than just communication support. Our role as speech language therapists, whether it's for supporting someone with their communication changes or supporting someone with their swallowing changes, for me, it all comes back down to connection. So even if you have difficulty swallowing, it doesn't matter what texture diet you're on. Actually, the role that we play is making sure that you're able to still connect with food in a way that gives you purpose, gives you dignity, gives you meaning, and that you can still engage in practices around food and eating with whānau. Because most of us, you know, we sit around a table, we share stories at that time, and if your engagement with food changes, then you know it changes that connection as well. So leading back to communication, you know, I've listening to both Annabel and again with Nick and Cheryl, you know, just bringing those things together. So effective communication is sharing that speaker's knowledge, the listener's knowledge, and then that shared knowledge. And talking is like dancing is a really nice analogy of thinking about it's a relationship between a person and something else. And then Nick, you talked about the power of touch and how valuable that is for demonstrating connection, building connection. I'll let Megan talk in a little moment as well, but I want to share a story about a lady that I worked with who has a primary progressive aphasia, which is a subvariant of a frontotemporal dementia. And for her, when she first started coming along to our cognitive communication groups, she was often looking down. She wasn't actively engaged verbally. She wasn't participating in conversation much as you would expect for someone who has been invited to a communication group. And I remember one of the students asking, you know, is there, you know, should she be invited back to the next one? Is this something that's actually making a difference for her? And trying to shift that student's perception of what does participation look like for this lady. Like participation for some people is a verbal contribution. Participation for her was more that she was engaged with the activity. Was she looking at the activity? Was she looking around the group as other people were speaking? Did she smile and laugh when other people were smiling and laughing? And when they shifted the perception to think that, yeah, she was doing those things. She was mirroring what she was seeing. She was, you know, she would look up, she would point at things, that actually she was participating. It just wasn't as they were expecting her or wanting her to with verbal communication. You know, and she's come along to our group a couple of times now, and what we're seeing is that where she used to walk into the room with her head down, she now walks in with her head high and she smiles at people as she walks in. So that whole process of what does participation engagement look like for someone can be very different. But for me, that's my philosophy of communication, is trying to think about how do people connect and how do we support that connection. But Megan, I'll hand to you. I don't know if you want to elaborate on that in this section or if you want to carry on with the next part.
Yeah, brilliant. If you jump to the next slide, actually, would be great.
Yeah.
Hilda. Yeah, so just to build on that, I really do believe that connection looks different to all of us. My personal philosophy around communication, I guess, is building up through some of the study we've done, looking at Māori ancestral communication. So recently we analysed over 2,500 whakatauki or ancestral sayings to try and get a better understanding of how our tupuna, how our ancestors viewed and understood and thought about communicating. And I love what Katrina said, that connection is about a relationship to something. And I think that one of the biggest takeaways from the study was that in Te Ao Māori, in the Māori world, it wasn't necessarily just about a person-to-person conversation even, and that was hugely important, of course, but we also had this connection to Te Ao Wairua, to our spiritual world, to Te Ao Tūroa, our physical world, and to Te Taiao, the natural environment as well. And all of these things came into connection. And I think one of the best ways I could describe this, if you can jump to the next slide, Katrina, thank you, is by giving one example of a simple communicative gesture, and that is aroaro haki, which is also known as wiri wiri. And you might have seen this, the sort of shimmering or quivering of the hands that you might have seen in kapahaka. And people will use it to accompany the waiata, the song, or the chant of the haka. And it's a way of expressing the mood of the music, or the mood of the meaning of what's held within those words. And so kind of on the surface level, we can see it's a physical, a bodily expression. But we also have a tie to our spiritual and our environmental worlds through this action as well. So wiri wiri, or aroaro haki, it comes from tāne rore. So tāne rore is the son of Tamanui Te Rā, the sun in the sky, and Hine Raumati, the summer maiden. And he's known as the originator of the haka. So aroaro haki comes from him, and it's a connection that we have to our atua, to our gods. And at the same time, there's an environmental, natural tie as well, because aroaro haki is known as this shimmering air that you might see on a hot day. And some people talk about it as being a communication that comes from the universe and through the wairua, through the spirit of a person, and then out through their body. So this is just one example to show this kind of interconnectedness of all of these different worlds that happen when we communicate. And there's an idea that kind of keeps on coming up in ancestral knowledge. Next slide, please. Thank you. So I wanted to look a little closer into the spiritual side of things, because I think for a lot of Māori, mate wareware is a spiritual journey. And we see spirituality coming into communication as well. We found it in things like mauri, so all our messages having this life force. So like everything that's animate in the world, messages have their own kind of a life energy. We also see it with mana, that communication was guided by mana, or by spiritual power. People often think of mana as something that's attached to people, and it certainly was. So the greater a person's mana, the more weight and authority and power that their words had. But we also saw that Te Reo Māori, Māori language has its own mana as well. And then of course, wairua, which is our spirituality. So like I mentioned in that previous example, a lot of communication actually happened through the wairua, through the spirit. And we were very capable, and still are, of communicating with our atua, with our gods, and drawing on their influence through things like karakia. which in traditional times would be done routinely, would be a very regular thing, something that was done daily. So this wider spirituality side of communication was something that came into our daily life. Next slide. Thank you. And this idea of this interconnectedness with our whole world, with our spiritual world, with our environment as well, was also coming through in conversations with people who have, with Māori people who have mate wareware. So I wanted to share an example of a discussion that I had with a recent participant. When I asked him, what is needed to support communication for you? His answer was cultural connectedness. And he explained that by giving me an example. And his example was, in Te Ao Māori, when you first meet somebody and you find out that they're Māori, your first question is normally, no hea koe, where are you from? Or what's your surname? So these questions are asked to find out, you know, who and what are you in relationship with in this world? And then can I find a connection that I have to one of those places or ancestors? So this is a really essential part of connecting with people. And again, it's connecting us in with our wider world. And he was talking about how this is kind of changing a bit. So one of his kids was talking to him recently about one of his best friends, and he'd asked his child, you know, oh, where are they from? What's their surname? Who are their parents? And the kid said, oh, I don't know. And he said, well, you don't know them if you haven't asked those questions. So for him, it was that connectedness was such an essential part of being in a relationship with a person. Next slide, please, Katrina.
I might just elaborate there too. So
Yeah.
my son is often coming home with new whanaunga, new relatives, because they whakapapa to the same somewhere, or they have the same waka, or they have the same something, and he'll come home and he'll be like, do you know, we're also related to this person. So yeah, you're quite right about that relationship building and connection. Yeah.
I just found a whanaunga in the chat, I think, too. Kia ora, Sue. Yeah. But what does this actually mean? It's really, communication was not just about getting a message from a speaker to a listener as accurately as possible. And of course, that is a huge part of conversation, good conversation. But in Te Ao Māori, communication had a huge role to play in the quality of our relationships, in our connectedness to our world, and particularly to our spiritual connectedness as well. And I think at this point, I will hand back to you, Katrina.
This is a familiar whakatauki. I don't know if it's familiar just to me working in speech language therapy, that we hear it very often, or if other people are as familiar, ko toku reo toku ohoho, ko toku reo toku māpahi mauria. My language is my awakening. My language is the window to my soul. And I think when we're thinking about identity, how we communicate with other people is hugely tied into that. So if we're thinking about, you know, building connection with others, or the ways in which we use language, is so tied into our culture, our identity. And it's not just our culture that we identify with ethnically. It could be our age, a cohort that we've grown up with, all those pop culture references that shape how we connect and engage, or how we think. And so understanding a person's use of language, or a person's use of different idioms or different sayings, or how do they tell stories, those sorts of things can really give you an eye into how they see themselves and how they identify. So it's just something there to highlight, I think. Handing it back.
Yeah, thank you. And this is something that's been said many times already today, but just to build on the idea that communication is more than words. I think particularly for Māori, people will often talk about Māori as being an oral people, and that's because we didn't have a written verbal language before European arrival. But what we were been finding is, yes, spoken language is hugely important and a huge part of Māori culture, but it's accompanied by this real richness of emotional expression, bodily expression, also being able to read the environment and read signs around us. So we actually have this real richness of many different ways of being able to communicate and connect. If you can go too forward, I think, Katrina. I'll just give a couple of examples of, one more. Perfect. So just to give a few examples of some of the whakatauki or the ancestral knowledge around these concepts. And the first one is tohu, or signs or instructions. And these were largely things that came from our natural environment, things like the positioning of the stars or the migration patterns of animals, or the cry of birds. And they gave us signs for when was the right time to carry out activities that were essential for survival. And this is a really nice example and a good time of year for it. Ka rere a matariki, ka wera te hinu. So that's talking about when the Pleiades, when matariki rises, the fat is heated. And what that is meaning is when matariki rose, it was a sign to our tupuna, to our ancestors, that it was the right time to go and catch kiriru, catch pigeons in large quantities. And then they would be heated in their own fat. That's ka wera te hinu, to heat the fat and preserve those birds for eating at a later date. And there are so many examples of these tohu, and there's this sort of ability that we had to read our natural surroundings. You can jump one forward, Katrina. Tohu can also take the form of body language as well. So we also have this ability to read bodies. And this is a nice example, mehero whārangi te kanohi. The face is like the leaf of the whārangi. So the whārangi being a native tree that has these pale green leaves. And it's talking about how you notice it or you see on a person's face when they become whakamā, when they become pale out of embarrassment or shame. That's a bit of a clue to what might be happening on the inside, what their inner emotional state is like, and we can read that on the body of a person. If you can jump one more forwards. And that kind of ties in with this idea about whatu manawa, or this open expression of emotion, which was in traditional times a really normal and accepted thing for Māori, both for women and for men. Things like to openly cry, to openly be emotional in front of other people was a normal thing to do. And I think we have an old whakatauki on here, but yeah, this is a nice example. Ko roimata ko hupe ana ke ngā kaiutu, i ngā patu aitua. Tears and mucus only are the avengers of strokes of misfortune. So in the old times, it was very common to see people, this is talking about grief, but very openly grieving, shedding tears and mucus was a really normal thing. And if you jump one more forward, and some of these ideas are coming through in conversations as well with people who are currently experiencing mate wareware, particularly talking about partners who have learned how to read the emotional state of their loved one, or how to read the body of their loved one and actually adapt their interaction style to fit that. And I think that these are all just beautiful examples of kind of I would call it like traditional literacy. It might not be literacy as in reading written words, but it's a form of reading, because we're tuned into and getting information from our surroundings, from other people's bodies. And I think in the mate wareware context is something for us to remember when words can become more difficult, that we have all of these other resources to draw on as well. And like people have been saying, whether it's just a positive touch, or maybe it's just a simple eyebrow raise or a head lift or something, that these can still be moments of beautiful connection. And I think I will pass it back to Katrina for more of a practical spin on this.
Thanks, Megan, for sharing all of those as well. So I think from here, I've posed these as more reflective questions, because I think how we engage with other people and how other people engage with us it can be very personal, and utilizing some of those strategies, particularly which Annabel had talked about earlier, is really helpful to supporting conversation and supporting communication. But I think also challenging ourselves to think about, how do we perceive meaningful connection, and how do we align this with what meaningful connection looks like for that other person? And what are some ways that we can connect and engage with that person? So thinking outside of just supporting the conversation, but thinking about what are some other ways we can connect and engage that involves, like Cheryl said, singing and dancing around the room, or, walking, as Nick said, into that person's reality and sharing and asking questions rather than challenging, but stepping in and asking them to elaborate and turn that into a meaningful connection through storytelling, and having a conversation, even if it's not something that is relatively meaningful right now for us. And then how do we reinforce communication outside of talking? So particularly if these are things that we think are really important and we want to reinforce for our person that we love, how do we encourage that in other people who are connecting with them? How do we encourage that with others to see that whilst they might not be able to sit and have a conversation anymore, what are the things that they're still able to do that we can reinforce that and encourage participation outside of just conversation? I think, I don't know about many others, but sometimes for me with my family, connection can be sitting on the couch together watching the same movie. There's no dialogue happening in that situation, but we're connecting in that moment because it's a shared experience. So what are some of the shared experiences that you can have that is reinforcing connection outside of conversation? And from here, I've just got a small list of references in our email contacts if anyone should like to get in touch with Megan or myself. But ngā mihi, thank you.
Thank you so much. It was so lovely that we had Annabel talking about that idea of the quilt, because doesn't it feel like that it has been within our different speakers? There's been this quilt where you're all really resonating with each other and going, yes, and it's all building up. I love that. So we've had so many comments coming through, just saying about how much people are appreciating and how generous you've been with what you're sharing. And one of the things that someone has said is about how much they've appreciated bringing in that discussion about when dementia mate wareware becomes more advanced and verbal communication is more difficult. And you talked about that idea about sharing experiences. You don't have to both be sharing words, you can be sharing experiences. And I just wondered if that's something that you might like to expand on a bit for Caroline, about some of the things that might be useful in those kind of situations.
Yeah, I have a quick thought on that. One of the things I've heard people describe is even just having kai, and I think Katrina talked about this a bit at the beginning, but it can be, it's a form of communication in itself, because it's an expression of your aroha for that person. If you're going out of your way to prepare the kai, or even if you're going down to the shop to buy it, but you're you know, you have that person in mind, and it's an expression of your love for them. And the way I've heard people talking about it also connects us back into place as well, because it's where that kai is sourced from. So it's kind of, again, all these layers that come into it that give us that connection. Yeah, I think that's quite beautiful.
Thank you, Megan. That is beautiful. Katrina, is there anything that you'd like to add there?
There probably is, and I've totally hitting that baby brain moment where I'm like, I can't just draw anything right now. Yeah.
Lovely. Just putting it out there, I don't know if Annabel or Cheryl or Nick would like to share anything that they've, you know, drawn on or found particularly useful when moving beyond words.
I'm just always reminded of is it Valerie Fail? Her what's the name of the technique that she uses? It's the very deep listening.
Validation?
Yeah, validation. She just is somebody who you see her reading the other person's body language and perhaps sort of mirroring, and then trying some music, bringing in some singing, something that she thinks that they might identify with, and that connection that, you know, you see the documentary, people listen to music that is meaningful to them or begin to join in a song, and then afterwards are a little bit more awakened or able to, you know, get some words out because they've that's really, I guess, got the neurons firing in their brain. So I know that, yeah, often music is you know, personal music can be one way. And just, you know, people have talked about touch, even just, you know, getting some hand cream and giving someone a massage, a hand massage, or yeah, you know, strolling in the garden and smelling the flowers, literally, you know, those, bringing in those other senses maybe.
Yeah, I think that's lovely. And I know that we did have someone commenting about that thing, about the idea of massage as being something that can connect beyond words, as we were saying. And I know that idea of connecting with outside can be extremely meaningful to some people, can't they? And I know, Nick, I hope you don't mind me shoulder tapping you, but I've heard you talk about someone who wanted to go to heaven, and
Yes.
that, yeah.
Yes.
Would you like to tell that story?
Yeah. In fact, when Anne got put into care, I in the care centre which Brian was in as well, there was this woman sitting in. I recognised her. I was in the pharmaceutical industry, and she happened to be a nurse in a country practice, and she was effective, as they call the sergeant at the desk. So when you call there, she decided who you see, how long you see them, and when your time's up, she'd ring a bell and you'd get out. And for want of a name, I recognised Bobby. And part of, as you know, it's part of with the dementia, particularly D6 and D3 units, they have the sundowning period of the day towards the end of the day where everybody's tired and ratty and starting to live in their own imaginary world. And Bobby had this thing of screaming and shouting and throwing things at people, saying, "I want to go to heaven, please, I want to go to heaven." And the nurses and the carers kept on saying, "Bobby, you're in heaven, you're with us, you're quite safe." But that never sufficed. She still got angry, and this went night after night. And I sat there one night thinking, hang on, this woman really wants to go to heaven. So I said to the nurse, the charge nurse at the time, could you please put Bobby in the wheelchair? I'm taking her for a walk. She said, where are you taking her to? I said, I'm taking her to heaven. And she looked at me like I was a bit silly. I took Bobby through all the little gardens, interleading gardens between different sections in this unit. And I pointed the rose. Isn't God wonderful? Look at the beautiful roses he created. There's a bird bath with sparrows and blackbirds. I said, look at the birds in heaven, Bobby. Just spoke her through the whole concept of heaven, how beautiful it was. Then she really got angry. She said, well, where do I live? I said, he's even got a room for you. And I took her back to her room. I said, look, you've got all your photographs of your family up on the wall. There was a bunch of flowers on the table. Took her back into the lounge, sat her down. She calmed down, ate her dinner. Never ever again did she want to go to heaven. That sufficed the need at the moment, at the time. So that is important. Entering the world, believing what they're saying, and making their world realistic. So it's not medication, it's what is the cause of the aggravation.
That's such a lovely thing, and I think that's something that everyone's talked about is going underneath. Sometimes when people are saying things over and over, it's thinking this is really important. It's not just the words. What is it that they're seeking? And we've actually had a question come up from someone, and I'm going to put this out to everybody, about people who keep asking to go home, and how people can constructively respond to something that is obviously a very powerful emotion for the person, and what they can do in that kind of a situation. So Cheryl?
From my perspective, particularly if they're in a care home, home is a place of safety. Home is where they feel loved and supported and comfortable and safe. It's not necessarily the bricks and mortar of where they used to live. So I just think families and staff have just got to step up that one-on-one care with them to make them feel loved and supported. And there's a little story that I'll say too, and it's like the physician says to the student nurse, what should we give this person with dementia? Love is what you're going to give them. What if that's not enough? The physician says double the dose. So it's a feeling. To me, it's always a feeling. It's not bricks and mortar. It's how you make them feel.
Can I just say, Andy, what Cheryl's just saying now is important to us that we have professionals like we have here on this panel today, listening to us, carers. We have walked those miles. Excuse me, I'm getting all emotional now. Just listening to what we've got to say. And that it's a real world out there, people that are battling with people with dementia. All we need is the support of the professionals out there within those institutes, within those networks, just working in with carers. We walked the miles. When we talk to nurses, we started off by saying, well, you're the professionals. Now we say, hang on, we are the professionals. We have walked in your same shoes. We have cared for, we've done all the cares. Both Cheryl and I have done all the cares for our, we've changed beds, we've had to do loads of washing, we've had inappropriate behaviour, been through all those stages with our loved ones, even before we put them in care. So, the industry out there is invaluable. The nurses, the carers do an amazing job, and we can say from the onset, we should have said that they do an amazing job. And it's not from a critique point, not from a critique point of view, it's from a view of trying to help people with dementia and help dementia at large.
Oh, thank you so much, so much, Nick. And I think that's one of the things that I just love about today is someone has said, that idea of this whole holistic, that when we're talking about communication, we're talking about people, and we're talking about everything that is important to that person. And I just love how strongly that's come through today. So thank you so much. Was there anything that any of our other speakers would like to add to that situation of someone who's asking to go home? Because it's something we do hear so often, isn't it? So I don't know if anybody would like to add that. Annabel?
I wrote in the chat that it just depends on the person. There's no one answer. But if for some, the memory book approach might work. There is an example by somebody who did lots of research of memory books of a it wasn't in care, but it was a lady who after dinner with her husband at home would say, I want to go home now. So for her, she didn't feel she was in the right place. And it was a big issue, and it came up night after night, and he was despairing. And then he did, taking the idea of a book, took a photo of the house and just the statement underneath, I've been living in this house for 30 years. And so after dinner, he'd bring out the book or the example, and they'd look at it together. And she didn't ask the question anymore. Whereas previously he'd even gone so far as to put her in the car and drive her all the way around the block and say, right, we're home now. It was a pain. But so sometimes having a photo and having the statement, for the home that, I lived here in Birkenhead for 30 years, and then a photo of the place they're living now, the residential home, I live here, and the idea of feeling safe, they take good care of me here, I'm loved, or, for some people, maybe that sort of approach of, having a tangible, explanation might help.
Yeah. And I think, Annabel, you've just kind of reminding for me about the way they're losing that sense of being in your familiar space. It can be a grief, and that memory books can also have a real role to play when people are grieving, and whether you'd like to sort of talk us through how that idea of having a way to help people in those kind of situations through loss, that memory books can come into their own there too, can't they?
Yeah, I mean, I always see them as a tool for maintaining somebody's identity and their personhood, so that they are not, they're not a patient, they're, an individual with a very rich history, and the book can be a way of capturing that, who they are at their core, what things bring them joy over their lifespan, and their favorite stories and photos of their friends. So I guess if the book does a good job, perhaps it would help them to remember the good times in times where they may be grieving. So because there's sort of more, there can be, that's sort of a memory book of this is your life. Other people do practices of life review, where rather you look back on your life and think about where you've been and what decisions you made, and kind of to wrap up your life. That's a whole different process. And I guess that's when, our colleagues in the sort of psychological field might have a different perspective to add. Katrina?
I would probably say the same thing. Like, I was thinking memory books is where I went as well, and very much so that idea that it is very different for everyone. Like, no one's going to have the right, like, this is where giving strategies in one big lump of here's a list of strategies can be unhelpful for some, because you have to individually work through every single one to figure out which one's going to be the one that works. And that's definitely one that I would start with, is let's try one of these other ways to either redirect or use some sort of visual aid to support, so that that person has something in front of them, and it takes the pressure off the person having to repeat or share that as well every single time. Yeah.
Thank you so much. And we're coming up to the end of our time, and again, I can only just echo all the comments that are coming through about just how much this has been a time that is really centered in on expressing love, and that is something that actually can get hidden in amongst all the daily busyness, that this has been so much about celebrating the whole person and expressing love. And wow, that's just a huge thing to have been able to spend this time to do. And thank you so much for bringing yourself into this. And like you were saying, Katrina, we can't have a recipe book of what works every time, but oh my gosh, so many tools for the toolkit. It feels like the toolkit has expanded. So it may not work every time, but we've got a lot more things in that toolkit to draw on. So as we draw to a close, ka whakakairiri te tapu kia wātia ai te ara, kia turaki whakatahi ai, kia turaki whakataha ai, hui e. So the restrictions are moved aside and the pathway is clear and we're ready to return to our everyday activities, feeling enriched, unified and blessed. And I think that is very true for today. So thank you so much to our speakers. Thank you to everyone for your time today. And we will be putting up all these amazing resources and emailing you out where you can find the videos, where you can find those resources and the PowerPoints and all the things that people have been asking for, because I know people really want these tools and all this wonderful learning. So thank you very much to everyone and all the best for the rest of your day.